The number one problem that I have parents come to me for is my child is a picky eater. Mm-hmm. And I feel like the first thing is realizing that the symptom is just a symptom for the most part, but we're trying to get to that root cause.
Getting to that root cause, looking at those things first before that Band-Aid approach. This is all about that integrative, holistic approach that you bring to the table, in addition to whoever they're wanting to be in their healthcare team. You're just an added piece to that, and you're giving that guidance, support, the plan, the recommendations.
We have to be the advocates for our own health.
Welcome, everyone, to the Patient Advocacy Initiative podcast. My name is Dr. Asha Bohannon. Super excited to have you guys here to listen to my guest today. This is Dr. Adeola Chukwumah, a pioneer in holistic integrative health who empowers busy moms, professional moms, to enhance their children's well-being through nutrition. So leveraging nutrition to help our children. With a background in pharmacy and public health, Adeola realized early on, actually, that the limitations of traditional approaches and started learning more about functional medicine. And over 2 decades, she acquired various certifications in integrative health coaching and focusing on addressing root causes for optimal health. So really excited. As a mother, she also navigated her son's health challenges. And Adeola really understands the unique struggles faced by career-driven moms, which a lot of us are. So I'm really excited to have her here to talk about her work in her company, The Wellness Keys. She develops personalized strategies for moms that she works with. And I always love to bring in some fun facts about our guests. So I'm going to start with Dr. Chukwumah. Loves to dance, sing, read, and cook. And she also loves to travel and experience how other cultures and other people live. And one other fun fact is that she used to be a competitive ballroom dancer. So I'm excited to have you here, Dr. Adeola. Thank you for being here today. I'm looking forward to diving in this with you.
Oh, thank you so much, Dr. Asha. I appreciate you. I think every one of us should read our own biographies every day. It would just help your outlook, and you just sound so much more than you feel you are. So thank you. That was great hearing that.
Oh, well, I appreciate it. No, I appreciate you being here. And you know how much I love working with you. So I want to dive in because, I mentioned that you started dealing with your son's health challenges. And I do believe this is kind of what sparked you to start the Wellness Keys and really dive into this sector of children's health. So would you be willing to share more about that journey?
Oh, absolutely. So it's probably about 8 years ago now. And he just had some tummy issues. It seemed like it was gut related. He was, throwing up, having tummy aches. And I just remember, when it first started, they would, the first time they called us from school and you had to come pick your child up if, they're sick. And I was in a meeting. And so I was, my husband was traveling, I was in a meeting, and my work is about an hour away, or was at that time, an hour away from my home and the school. And so, I had to get out of the meeting feeling just that guilt that here I am trying to, move forward in my career, but my child comes first. And so I left the meeting, went to pick him up. And then it kind of started a strange pattern. Every other day that I would get a call, come pick him up, his tummy hurts, or he just threw up or something. And so we started the process of taking him to the pediatrician to figure out what was wrong. And we changed pediatricians 3 times.
Wow.
Because they just didn't seem to be listening. They just, they would prescribe some type of medicine, take Tums. Someone gave us, Prilosec at one point, just throwing some names out there. And I just felt like, okay, that's fine. but you're not going to the root of what's wrong. They could never tell me. Finally, we found this gastroenterologist who said, she would go through the whole workup to see if he had H. pylori or an obstruction. And so he had to do some procedures. He had, I remember the endoscopy that he had, and just feeling as we sat there waiting for him to wake up, thinking, oh, my baby is being put under all of this stress. And finally, it was when somebody said, we may have to do surgery. I was like, you know what? We have to stop. This just needs to stop. You have no idea what's going on. And you've given us medicine. You have done some procedures. And now you want to do surgery without finalizing what the problem is. And so I started doing some searching online and kind of stumbled upon, I think I may have been Googling root causes or something like that, something to that effect. And we found a functional medicine pediatrician. I had no idea what that meant. I went to see her, and she listened, and she said, what we should do first before anything else is let's do some gut testing to see if we can find anything there. And if we do find anything, children respond really quickly to changes, slight changes in food, or maybe we have to do a supplement. And let's try that. And so she kind of calmed me down, and we did the testing. It's a fun process to do that for sure. And then we got the results back, and we found out that he had food sensitivities to a few things. And we took those things out of the diet. And what I noticed was, as I was taking things out of his diet, the whole family had to take those things out of their diet too. So my husband, and I have a daughter as well, we just kind of changed our food. As part of that process, I was introduced by that pediatrician to, I guess by background, she's a psychologist. But one of the things that was important that she taught parents was that the way that we kind of show up as parents to these children impacts the way that all of those hormones in their bodies react as well. And so my husband and I kind of had a plan of how we would change our parenting, looking at our stressors, looking at how, coming back from work and you're frustrated, how are you showing up for your child? And so we changed a lot of bringing in mindfulness and getting to bed on time. So not staying up to watch that show or do the work, all of those things that I think are really important as you're raising a child, in addition to the change in our nutrition. And I'm telling you, in 6 months, he was much better. And within a year, all of the symptoms were gone. So wow. We didn't have to be on medicine. We didn't have to have surgery. And he was fine. And I was relieved. I felt liberated. I felt like I knew what it was that I should have been doing and what I can do going forward. And I just remembered that mom guilt, that feeling of, I don't know what to do, and this is my child. And that was how it started. And so I started doing some more research on, could I get some certification? What could I learn more about functional medicine and integrative health and nutrition? And so I did get some certifications, and that was how the Wellness Keys was born, to help other moms who might be going through what I went through. I mean, I was busy working long hours, and here were some really, I don't know that they were always simple, but they were clear changes that we needed to make my child feel better. And so I want to kind of bring that to other moms as well.
Oh, I love everything that you said. So, there's so much I want to unpack there. So number one, a lot of what happens to all of us, a lot of the root causes of things start in the gut. There's this gut-brain connection. So when we talk about a lot of children, they could be experiencing gut symptoms, they may not be. but it could be impacting them somewhere in that line of from brain health to gut health to other chronic diseases that may be coming up. And so getting to that root cause, looking at those things first before that Band-Aid approach.
Absolutely.
Right. So everything that you described was a Band-Aid approach from, just here's a prescription, here's a surgery, here's another procedure that you have to go through, and not really getting to the root cause. And so I love that you had the foresight to look into that, to go dig deeper, to say no. A lot of parents, they get stuck. We feel stuck. I mean, there's no ifs, ands, or buts about it, right? Like we just want to do everything for our kids, and sometimes we just don't know what else to do. And so we do feel stuck. And so I love that you said that you didn't feel heard at one place, so you went to another and another until you found the person that was willing to listen. And what I know about you and what your work at the Wellness Keys and everything that the Wellness Keys stands for is about listening to what the parents are saying, what they're experiencing, and really helping guide them through what that experience is like. And when you're in I'm going to say the eye of the storm with your child and they're not feeling well, they feel helpless, you feel helpless. You really need somebody to kind of come and hold you to say, hey, I've got you, and we're going to look at all the different aspects. And so I love that you said all of those things. So I want you to dive a little bit deeper. As you were describing in your process in the 6 months, you and your husband looked at different things. You looked at mindfulness. And so I'd love to hear what it is that you're looking for to help, because obviously it helps the entire family when you're doing this, which I love. It should be a family effort when we're not just talking about that one individual. And so can you dive a little deeper into what are those things that you looked at besides just even nutrition or even the testing? What are the other aspects of life that you looked at?
You have to impact the whole family. Like you must impact the whole family, or whatever change you're trying to make will not be sustainable. You can't just focus on one person at the corner of the table doing their own thing. Your family is your little ecosystem, and everything needs to work together. So everyone needs to be involved in that process. The number one problem that I have parents come to me for is my child is a picky eater. Mm-hmm. And that could mean so many things. I mean, my son was a picky eater at that time too. Those were some of the symptoms that he had in addition to some of the other symptoms. So I feel like the first thing is realizing that the symptom is just a symptom for the most part, but we're trying to get to that root cause. When we talk about the gut-brain axis, as you spoke to, the gut and the brain are connected through our vagus nerve, and they're moving neurotransmitters and hormones just back and forth. And all of these neurotransmitters and hormones work on different parts of our bodies. So as an example, 90% of serotonin is made in your gut, and then it moves around your body. And a lack of it can show up as, lack of sleep, as anxiety or depression. So first of all, realizing, okay, whatever I'm seeing, we need to just get to that root cause, whatever that is, I think is the first thing everyone needs to do. So in addition to the gut testing that we did, and what I do with my patients as well, we also want to look at what we call primary food. And primary food is the things around your life that you're not putting in your mouth. However, if they're not in balance, they're going to impact what you put into your mouth. And so I think of food as the secondary food. So it's kind of a different outlook. So things like, how you're feeling with your job or with school. How do you feel connected to a community? All of those things that involve our well-being as humans are things that we look at. And so I have a circle of life map that we go through with each parent. The child can do that too if they're old enough, but the parent usually does that. And we try to figure out, okay, which one of these things are we the most pleased with? And so maybe we don't need too much help. And which ones do we need a little bit of help with? And once we do that, and then the parent gets to choose, here's what we want to focus on as well, in addition to whatever results that we saw in the gut testing, in looking at just the health history of that child. And then we go at it and we use a process called habit stacking, where we pick one thing, we set a goal, and we work on that thing. And then we start to add more and more of the goals that were on the list. And then we evaluate and we see how things get better. I will say that part of the evaluation also looks at whether there is something else that I may have to refer you for. I've had some patients where they needed to have a little more psychological help. And so we do that as well. But just because you're seeing another type of physician for something that may be going on doesn't mean that you don't need to support your body with whatever other therapies may be added. You always need to support your body so that you're keeping your microbiome, which is the trillions of bacteria that are in your gut, you're keeping them balanced. Because again, there is so much of how we function that starts in the gut. The goal is to get that as healthy as possible and keep it in balance. And then you'll see some of those symptoms just go away throughout the process.
I love what you just said, the integrative approach. So we think of, as practitioners and professional healthcare professionals, we think of the integrative approach being among the healthcare professional realm, right? Like we're integrating a healthcare team for the patient. But this is also the integrative approach to your own health and well-being. This is the holistic integrative approach of, yes, you can be having other things that you're using to help your health and well-being, but then we also have to bring this other extra pieces in that I think are the missing link, in my opinion, to our healthcare puzzle, is bringing in all of these added things and these symptoms that we are feeling. If we look at them as almost like signs, right? They're beacons or signs to say, hey, something is wrong. And so the fact that you may hear this from your child, you may see this in your child, you see this in yourself, right? Like there's a lot of different things that we're getting these signs and they're being ignored. And so you know your body better than anybody else, right? And your child will be able to tell you they're pretty resilient and they know when something's wrong. And so being able to listen to all of these things and then find somebody who's willing to listen to all of these things, put the pieces together for you and give you a plan to move forward is really important. And so I'm really excited that you're doing this. And I love that you also said as parents, like we need to be modeling how to do this stuff for our children, because if they're not getting it from us, where are they getting it from? Right. So that's an excellent piece to it. And to also say that this is all about that integrative, holistic approach that you bring to the table, in addition to whoever else practitioner they're seeing, whoever they're wanting to be in their healthcare team. You're just an added piece to that. And you're giving that guidance, support, the plan, the recommendations. Something that I love that you said too, is that you're going to do the research. You're going to help them figure out what is the right information for them, because there's, 50 million bits of information coming at us at every second of every day. Right. So really helping them get to what is right for me, what is right for my child, and getting into the root of the problem. And so I love that.
I love that too. I love that. I wanted to add.
Yeah.
So we are all bio-individual.
Mm-hmm.
We are totally different. I am totally different from my child. I'm totally different from you. So the things that will work for me may not work for you. And you need to be in a space or have that support where we can try different things. So if A doesn't work, as an example, we, decide to add this supplement as an example based on what we saw in the testing. And it's not, after some time, we give ourselves some time and it's not working, then it's okay to change and try something else. because we're not all the same. That one size fits all that we see out there. Hopefully we can get to a point where we know that, I may be different. I may not fit that mold, and it's okay.
It is okay. We're not cookie cutter, right? That not everything is going to be the exact same for every person. And I love that you stick by your clients and you help them understand what's right for them, right? So we can try different things. But what I also love is the trial and error is a far less when you have somebody that's actually sitting there trying to decipher what can be right for you. It's not just throwing spaghetti at the wall to see what will stick.
Absolutely.
Right? There's more of an intentional way of looking at you as a patient sitting in front of you, right? So, and so I think that's really important to know too, is that it's not a cookie cutter process. It's very individualized, and I just love everything that you do. So, I have young children, I have teenagers, and the picky eater aspects and things like that. And so to know that there's a reason why these things might be happening, how we can get around them is so important. So I love everything that you do. We're going to have to absolutely dive into probably this picky eating concept at another time. So I'd love to have you back on the podcast to dive into more specifics. But at this point in time, I always love to have you share if there's one thing that you could tell our audience, or one thing that you could have them take away from this, what would that be?
Just one thing. That's hard. I will say, the days of thinking of your healthcare system as trying to draw you in to help you, I think those days are gone. We have to be the advocates for our own health. We have to speak up. If something is uncomfortable, make sure you speak to your provider that, hey, can you explain this? Why am I taking this? What's next? So I think our own self-advocacy, and as a mother, you are the number one advocate for your child. So that has to be number one. Listening to that, no pun intended, that gut feel that you might have, because it's real. And being unafraid to advocate for your child. I would say that in addition to that we really need to work a little bit better on, as we're going through the process for our children, also thinking about how our behaviors, how our outlook, what we are eating, the things that we are doing. As you stated earlier, that modeling is really important. So advocating for yourself and your child throughout the process is number one. And then we need to think about what we can do to make ourselves, healthier, more mindful, more at peace, because it directly impacts how your child's outlook will be as well.
Love everything about both of those. I'm going to say golden nuggets, in my opinion. So as a busy professional mom, I love everything that you're saying, and we all need to take that advice. So thank you for being on. We will have all of Dr. Adeola's information and how to contact her at the Wellness Keys in the show notes. And thank you again for being here, Dr. Adeola.
Thank you for having
every
me.
bit of it. Yes, thank you.
I appreciate you. Thank you.